Hi, Floor 51 students. Dr. Piontek here. Just wanted to go over with you a few things about Module 4. So in this module, we're really going to be looking at the county health rankings, as well as some other community resources to really get a good grasp of certain health-related issues that are occurring, where your county ranks among other counties in your state. Which I find that incredibly useful and interesting. We're going to be looking at fact finders. So let's go ahead and dive right on into the module. So the first item that you're going to be doing is reviewing this video. It's Introduction to County Health Rankings. This is sponsored by the Robert Wood Johnson Foundation. So please review that. And then as you scroll down, we're going to be looking at the county health rankings. This is out of the University of Wisconsin, their model. So if you start at the let's start at the bottom. We look at policies and programs and how they tie in with health factors, and then finally health outcomes. And so you can just take a look at this model here. If you notice behaviors, clinical care, social and economic factors, and then the physical environment. These all really tick and tie in with that socio-ecological model that you learned about a couple of modules ago. So as we scroll down a little bit further, there are a couple of resources. The county health rankings here. So this and this, they're the same, but you click on one of those two and that'll bring you right into the county health rankings. It has the 2017 county health rankings here. The 2018 might be out already, so you can go ahead and click on there and discover the most up-to-date county health rankings. And then the CDC has a community health assessment for population health improvement PDF file that I'd like for you to review. And then of course partnerships are instrumental in getting things done. So if you think of just one person being able to move a mountain, it's not going, well, we can't move a mountain. If you think of one person who's going to make a great impact, sometimes it's very hard to do that. But if you have a group of people, you can certainly accomplish those goals. And so it stems along with looking at the partnerships that can be built within a community. So area churches, maybe area health improvement organizations like the YMCA. That's a great partnership. I think it was mentioned in last week's discussion board about a partnership with the YMCA and a latchkey program. So maybe partnering with the law enforcement agencies, partnering with farmers, local farmers, to bring in fresh produce to areas where it's a known food desert and people can't get fresh fruits and vegetables. So that's all an example of the partnerships that can occur within a community. And then there's another PDF I'd like for you to review. It's a summary IRS rural community health assessment. And then I want to briefly talk about the Population Health Project. Now this is not due until Module 7, okay? This is an ongoing paper that you're gonna start now in Module 7 and work on it you'll just start now in Module 4, work on it during Module 4, 5, 6, 7, and then you're going to turn it in at the end of Module 7. So if we bring up that rubric, it is your synthesis paper. It's also called Putting It All Together. All right, so this is the rubric for the paper. If you notice, the idea is to find you'll be looking at a county or looking at a community. You're going to be doing a windshield survey, which is due in this module. We'll talk about that in a little bit. You're going to look at those county health rankings. You're going to identify a health issue. And then you're going to be looking at that health issue and how it stacks up with the Healthy People 2020, how individual behaviors impact the health issue, what social issues are impacting that health issue, what environmental issues impact that health issue, academic issues, cultural issues, policy issues. So if you think about this, that really goes back to that socio-ecological model. Finally, you're going to examine how that health-related issue impacts vulnerable populations, and are there any disparities related to this health issue, health disparities related to this health issue. Then you're going to be looking at the evidence. What's out there that can address this health-related issue? So you're going to be looking at the literature. First off, you're going to describe at the community level an intervention that's appropriate to the identified health-related issue. You'll access that through the community guide or community health improvement navigator, and in module 5 there are links for that. Okay, you'll identify and briefly describe the community level intervention appropriate to the identified health-related issue by accessing the literature. So you want to look at what evidence-based program or intervention is already out there that can be implemented into your population. I want you in this section explain why you chose the program or intervention, explain what determinants of health are addressed, again going at the social, economic, environmental, cultural, policy level, and how the intervention addresses the determinants of health. Then I want you to explain the importance of collaboration in implementing the program or intervention, identify community partners to promote success, and finally explain how you would engage the partners and the stakeholders. Then when we skip down to the implementation, briefly describe how you would roll out the program. All right, so where would you have the program? Would you need to have this in a large auditorium? Would this be something that you would do at a health fair? Is this something you would be doing in a school? So basically, that would be one aspect, is the location. What venue would you choose? And then how are you going to get people to come to your program? How are you going to bring people into this so they understand the program and so that they can take part in it? What partnerships are you going to bring in order to maximize that? And then how are you going to evaluate the effectiveness of the project or your program? So that's really important when you go back to the outcomes. What are the outcomes of the program? What health-related issue is there? When you implement this program, what do you hope to see as an outcome? So think about going back to those SMART objectives a little bit, if you will, and put together some kind of a education paragraph, or excuse me, evaluation paragraph of how you would evaluate the program and determine if the program was effective. And then finally, the reflection conclusion portion. Now this is a portion of the paper, and only this portion of the paper, you can use first person I. So when you're writing a reflection, I don't mind you using first person, but for the paper leading up to this, please avoid using first person or second person. Stick to third person. Okay, if you have any questions about that, let me know. So this is the reflective component. I'll let you read on that, and then make sure you hit all those points. APA, obviously, anytime there's a big paper, we have to look at APA, so make sure you read that section. One thing that I really, really want you to listen to and to jot a note down, make sure that you are using headings. Okay, so you have an introduction heading, you have assessment, problem identification, evidence-based plan, implementation, evaluation, and the reflection conclusion. Make sure those headings are in your paper. Okay, this makes it much easier for the reader to see the transition of the contents of your paper. Oftentimes when students forget to do this, they don't get their points. All right, so make sure, I want you to make sure you use those headings. Okay, make sure that you use correct APA formatting when writing your headings. So that is the putting it all together, my population health project. So it is basically choosing your community and then doing that overview of the windshield survey, which is due in this module, looking at the county health rankings. So it's basically a research paper about your community, the community that you've chosen, you know, the county that you've chosen, an incorporation of the windshield survey, looking at possible partnerships, looking at health-related issues, looking at implementations or programs that you can use to address a health-related issue. And then, of course, obviously the component of reflection. So that is all I really had to say about that assignment. So going back then to Module 4, you do have the windshield survey and county health rankings fact finder census data assignment that is due. So I would like for you to complete this. You're going to choose a county of your interest. You can either choose the county that you live in, one that you work in, and basically something that it's relatable to what you'll be doing in Nursing 452, all right? And it's important to keep that in mind because a lot of the research that you're doing here in 451 is going to be carried over into 452. So it just really takes a lot of that extra workout that you would have to do in 452 if you just start here and make sure that you are looking at the county or the community that you would be doing your, well, we call it the practicum experience, but where you're going to be selecting your population for 452. All right, so there is a windshield survey form attached, and you'll access that through here. You're going to basically answer those questions. Please be as detailed as possible when you are answering those parameters. In the areas where you can simply answer yes or no, you'll be able to determine that by the question asked. If there is a question that triggers you to elaborate more, then you're going to need to elaborate. You can't just answer that particular type of question with a yes/no, okay? So make sure that you elaborate as much as you can. The purpose of this windshield survey is to really kind of go into the community and to go into looking at the facts behind the county and just doing an observation. All right, for example, if I take the community where I am right now, I have trains everywhere. So, you know, their trains are constantly running, so the train tracks are sort of the border of this particular community. So that could have a significant impact on many things. One is the health of the community. When you think of trains, you think of noise pollution. So when you have the train whistles blowing at 2 a.m. and at 3 a.m. and at 4 a.m., you know, it can certainly impact sleep. So we do, in this particular community, there is an interstate. So that's another area that is bordering where I am. So that is a benefit because it does get us from point A to point B very quickly. There is a hospital just less than a half mile from here. Actually, several hospitals. One is a half mile from here. Another one is about 2 miles from here. So lots of hospitals around. So we do not have an issue with access to emergency care if we need it, or to health care. It's a moderately, you know, so the people who live in this area, it's a lot of single family homes or upscale apartment buildings. And the average income is $64,000 for this particular area for the average household income. There are lots of schools in the area, public and private. So that's kind of what I would like for you to do is, you know, you already know a lot about your community, and then kind of take it a step further and really start looking at those, you know, avenues for healthcare, avenues for physical activity. We have sidewalks everywhere here. There's like parks everywhere. Like I said, one of the big things are the train tracks. It can be a safety issue for kiddos who are on those walking paths, you know, if they don't heed the oncoming trains. So that can certainly be a big health-related issue. So, and then, of course, the discussion board is due this module. So I think this covers everything in the module. If you have any questions, please do not hesitate to contact me. And don't forget, keep working on that Castle branch. I'll talk to you soon. Thanks.